Right, okay.
Tom, nice to see you. Thank you very much for allowing me to examine your lumbar spine today. The first thing I'm going to do, normally I'd have this patient more exposed than this. The first thing I'm going to do is look at, do a general inspection. So firstly, look at the anterior superior leg spines to make sure they're level and they're fine. Then I'm going to general look at the legs, look at the muscle bulk of the quads, make sure there's no discrepancy in there. Look at the knees, make sure there's no obvious varus or valgus deformity, and look at the feet at the arches and see if there's any pes cavus or pes planus, and if there is, that can often exacerbate back pain. They look absolutely fine to me. Okay, so the next thing I'm going to do is examine the patient from the side. Look at the spine, looking for normal cervical lordosis, normal thoracic kyphosis, and there's often normal lumbar lordosis as well. And if one of those is abnormal, often that can be a structural cause of back pain as well. But they obviously look fine if you turn them back to me. And again, this is inspection stage, so I'm just looking from behind for normal spine alignment, making sure there's no scoliosis, which there isn't, and just looking at the muscle bulk to make sure it's symmetrical, which in this case it is. That's fine, and turn your back round to me. Often I'd get the patient to walk as well, but when he was coming in the room his gait looked absolutely fine, but I'd often get them to walk. So just have a look now. And back you come. Oh, that's nice and normal. Great. So once inspection's done, we then look at movements. So in the lumbar spine, I tend to do the active movements in clinic generally. So the first movement I do is lumbar flexion. So if you can touch your toes to me. Good, he's a bit more flexible than me, and come back. That's nice and normal. So that's lumbar flexion. Next thing I like to do is lumbar extension, so come back. You're looking for 10 to 20 degrees in. Tom says about 30. So that's fine. Any pain when you went back?
No.
Often the patients have pain when they extend their spine. It's often due to facet joint disease. It's quite commonly due to that, but that's fine. Okay, so the next thing we're going to do is do some lateral flexion. So come down one side. That's great. And then the other side. Fantastic. That's nice and normal. So lateral flexion's normal as well. I do tend to, when I'm doing lumbar spine, look at the other movements, so the thoracic spine, the cervical spine as well. In this case, we won't do that. Okay, so one special test is Sherber's test. So if you have your back to me. So what we're going to do here is mark where the anterior superior leg spines are with a pen. There, where the dimples of Venus are. We're going to go 10 centimetres above that and 5 centimetres below it. And then we're going to ask Tom to touch his feet again, please. And we're expecting to see, that's fine, and come back. We're expecting to see an increase in that distance with the tape measure of more than 5 centimetres, and in Tom's case it was 8 centimetres. So that shows there's good range of movement in the lumbar spine in terms of flexion. If that's below 5 centimetres, you're often looking at things like ankylosing spondylitis or other conditions like that. So that's fine. The thing I often do before doing range of movement is actually palpation. So after inspection comes palpation. So we've already done movement, so we'll go back a step and we'll look at palpating the spine. So just start in the midline. Again, I tend to do the whole spine. So feeling the spinous processes, asking Tom if there's any tenderness.
No, that's fine.
That's fine. Just let me know if there is, because obviously I can't see his face. And again, here when you're feeling it, you're not only feeling for any tenderness, you can feel for the alignment as well. And feel the paraspinal muscles. Again, we'll concentrate on the lumbar area here. See if there's any tenderness in the paraspinal muscles. And just slightly more laterally and deeper to them are the facet joints, which are often irritable or can cause back pain. But you would probably tend to get that from the history. Any pain there when I feel?
No.
No. Okay, so we also feel for the sacroiliac joints. So just feel into the sacroiliac joints. Any pain there?
No.
Any pain there?
No.
So no pain in the sacroiliac joints, which is good. Okay, next I'm going to do some special tests on the lower limb. And can you lie down for me? And these are really looking to see if there's any radicular problem or problems in the spine, which may be impinging on the nerves, which can cause neurological symptoms in the legs. So obviously you get things from the history. The one special test that's important to do is the sciatic nerve stretch test. And patients normally can flex their hip to 80 to 90 degrees with relative ease, assuming they don't have tight hamstrings. So that's what we're going to do here. Is just going to lift up your leg passively, so I can do that for you. Any pain there?
No.
Slightly tight hamstrings here. If there was some pain, what I tend to do, it goes down the back of the leg, what I tend to do is just come a few degrees down from where the pain is, extend it a little more, and then just dorsiflex the foot to see if that brings the pain on. And if that's positive, that is indicative of a trap nerve or sciatica essentially. And the next thing I tend to do is power. So this is to do with myotones. So if you could lift this leg up for me and push up against me. So 1, 2, and down, 3, 4, good. Bend your knee for me, and kick out, 4, 5, and back in. That's one, good. Push your foot forward, up, push up against me, 4, 5, and keep the big toe up, that's S1, and push down. Good. And the power throughout the foot is normal. Then we're going to do reflexes. So, nice and relaxed in each one. So, the reflexes are present. So that's assessing L3, 4, L5, S1 here. So he's got a good ankle reflex. And always do planters as well. So just gently, with the back of the reflex out, and gently up the foot. And we're looking at the big toe and making sure it goes downwards, inferiorly, rather than upwards. If it went upwards, there would be a problem in the spinal cord itself. Any of these problems, if they've got sciatica, normally tend to MRI the spine to see where the problem is. So that's basically examination of the lumbar spine, which I tend to do in clinic. Thank you very much.
All right.